3, 2, 1.
Hi everybody, so it's our weekly catch-up, isn't it, about the COVID vaccine programme. So I've got some information to show you about how we got on last weekend and what we managed to achieve, and then also talking about this weekend and what we've got planned for the future, and pretty much that we don't know what it is, and answer any queries that you have. Now, same as the previous times, I don't have a GP with me, so I can't answer any clinical questions that you have. It's not appropriate for me to do so because everybody is unique and it's not in my skill set. So please just ask me kind of operational questions as such, and I'll do my very best to answer them. So let's just recap on the weekend, and I'm going to show you our numbers based on this. Let me have a look. Oh, 1 second. I did have it. Oh, here it is. Okay, so you should be able to see my screen in front of me. And these, I've taken off a few other details, but this is what we talked about last week about who's been invited. So we don't cover patients in care homes traditionally in terms of having a registered site. However, we do have 12 patients who are registered with us that are in care homes. 3 have been vaccinated, but the remaining 9, unfortunately, there are outbreaks of COVID and therefore cannot have the vaccination at the moment. Of our over 80s, you can see that everybody was invited, and 83%, that's 594 people, attended for their vaccine on Saturday or Sunday and have been vaccinated. That's awesome, absolutely brilliant. Now, the remaining patients now are either housebound, and indeed Amanda Butterworth and Sophie Waite will be contacting those people to arrange for one of them to come to the house to vaccinate using AstraZeneca. Okay, so that's going to be happening. It's going to take longer just due to the travel and the governance and assurance processes to make sure that AstraZeneca is kept safe. However, we will do that, and we are very, very hopeful that we're going to vaccinate you by the 12th of February. But somebody will be in touch. We will call you. Now, there are a few patients, indeed 39 in total, who we are not sure whether they're housebound or not, but we know that they didn't attend their appointment at the weekend, but they haven't been in touch with us. Now, some of them are in hospital, so of course vaccination isn't appropriate at the moment. And some we just can't get hold of, and others that we are reviewing to find out how best to vaccinate. So bear with us while we do that, but at least anybody here listening knows that we have a plan and nobody's been left out. Now, because we actually moved from 5 doses of vial to 6 doses of vial on the Saturday and Sunday afternoon, Saturday afternoon and all day Sunday, we've been actually able to increase the number of people that we were able to vaccinate. So we called people in who were actually aged 75 to 79 or indeed clinically extremely vulnerable. And as you can see, we were able to vaccinate quite a large number of those people during the weekend because we were able to use more doses than we thought that we could. So going into this weekend, it means that actually we've been able to invite also people aged 72, 73 and 74. So I can see that there's been a question raised whereby a couple, both in their 70 to 74-year-old age range, the husband has been invited for this weekend, but the wife hasn't. My only assumption based on that is that the husband is aged 72, 73 and 74, whilst the wife in this scenario is aged 70 or 71. And I'm really sorry about that, but we don't have enough vaccine to at this point in time, vaccinate everybody in that cohort. So we've invited everybody that we can, and we're looking to be able to vaccinate all of those people, as well as those health and care workers that we have that we need to vaccinate as well, those people that are part of the vaccination programme. So we are using all of our vaccine, and it was a great success last weekend. We vaccinated we used 1,045 vaccine out of a possible 1,070. Being really honest, 2 vials accidentally were dropped. had a pure accident, and the other 13 vials that we had only had 5 doses out of it, not 6. That wasn't from lack of trying, that's because they couldn't get the 6th dose out of those particular vials, which is always a risk. There's always that aspect. And indeed, I was really, really pleased, and the team have been over the moon that actually we were able to vaccinate 1,045. So we're going into this weekend hopeful. We're looking at the same numbers roughly at 1,040. If we can get 1,070, we will, but we have to just be prepared and estimate about a 1,040 remit. And we do have the AstraZeneca, remember, and we will be looking to vaccinate all those people who are housebound and also those people that can't have Pfizer. After this weekend, we should have our total numbers, and then those people who are mobile, we will look to hold a particular clinic for those people who have to have AstraZeneca if we've got sufficient numbers. And that's because, remember, out of every vial, we should be able to get 10 doses, and we need to use all 10 doses, otherwise we waste it. So we need to gather people together to get that sorted. So at the moment, we haven't vaccinated anybody with AstraZeneca. So here's the current position. And I'm pleased to say I was vaccinated because I've been working in the vaccine programme on Saturday and Sunday, helping everybody kind of get going. And although my arm was a bit sore, I haven't had any other symptoms. So, and I understand from lots of others that's been the case. So yeah, so far so good. Now let me just have a little look at the questions to see. I'm just going to take this page down to have a look to see what questions we've got. Now the vaccine being used this weekend is Pfizer again. Remember, we've got the 120-hour expiry date to be able to do that. Now, John Johnson has asked, is the second vaccination in any way different from the first? No, not that we know of. But remember, those people who were vaccinated this weekend need to come back on the 27th or 28th of March to be vaccinated under the current guidelines. We will be in contact, okay? You don't need to contact us. I don't know if there's any way of finding out whether or not the vaccine's giving you any level of immunity. I do know that you're supposed to wait 3 weeks for full effect for the first one of what the first vaccine can give you, but you need to have the second dose as well. Now, there's some good questions about wheelchairs, and I'm going to bring that up in a minute. I'm just making a note. We've got some thanks about how it went. Car parking, I'll talk about. Now, somebody said, once an elderly relative has received the COVID jab, how long is it before we can enter her house with masks on? Now, the guidance that we were giving out is that you have to maintain social distancing. You must maintain using face masks, okay? There is no reduction in the measures that you are taking at the present time. It will not stop you getting COVID. Again, I think people are asking which vaccine they'll get tomorrow. That is Pfizer. And I've already talked about what we're organising with home people who need vaccinated in their own homes. What's the advice if you're away from the area when you are invited for vaccination, travel perhaps 100 miles? I don't know the particular circumstances about why you're so far away at the present time to be able to comment on that. I think I've addressed all of these. Right, okay, and there's one about advisor to be able to do that. Okay, right, so let's talk about the arrangements for this weekend. So you all know the flow now. If you don't, please can you put that, and you want a reminder, can you put that in the live feed so that we can show the station map about the ways in which you'll be walking around the building. But I'm hoping that most of you have seen it already, and therefore we're just going to go to some set kind of questions. Now, wheelchairs. We only have one wheelchair, and remember, as much as we can wipe that wheelchair down, I can't tell you that it's COVID free in any way. Okay, I cannot fully decontaminate a wheelchair. It's being really honest, but we do have one, and it's about that risk assessment. So what we've got and what we've done is that we've only got the one. So if you bring your own wheelchair, that's better. But if you need to use ours, it's based at the front of the building. Now, what we've been advising people to do who require wheelchairs, regardless, is to actually be able to drive down right to the front of the building. Now, this Friday and Saturday, we will have stewards at the top of Wilson Road directing you where to go. They will have a walkie-talkie with them. And if you need assistance to get to the wheelchair entrance, they will guide you through that as you drive up to the building. So we have that available to you, which is different from last weekend, to assist. Okay, that also goes for your for people who are waiting kind of a car and can't walk so far but didn't need a wheelchair. When you come through the building, so you can take a seat at the station 7, that's the exit out of our reception area, and indeed your driver can drive right down to the front of the building and collect you from there. And our volunteers are there, willing and able to help to ensure that your travel is much less. So I've covered the car parking, I've covered the wheelchairs. I have spoken to the military again about the signage and to try and work out. I know it's not great. I need to keep trying to work with the council to come up with that because we do need better signage for everybody and everything about that. I totally understand it's a difficult building to find. Although it's huge, it's not obvious, and I understand that. And lastly, somebody else has asked about face masks. Now, yes, you should be wearing a face mask, but we totally understand exemptions. Now, we do have face shields, like a visor, that we will give to you if you don't come in with a face mask. If you have your own and you prefer that, no problem at all, but we do have your visors. And remember, this is about keeping you safe, okay? Keeping others safe in your cohort. This is about you working together to keep each other safe. Now, we maintain social distancing all the way through. We have dots for you to stand on. We have stewards and volunteers helping throughout. So although it is busy, it is coordinated and it is working through. And we've had so many positive feedback. Thank you so much for sharing your experiences. It is an absolute joy to read and makes us feel very kind of pleased and touched that, one, you made the effort, but also how safe and cared for that you felt. We had a birthday, a 90th birthday on Sunday. Okay, then we were fortunate, we were all wearing masks, so we were able to sing happy birthday in the waiting room. We had somebody that was dressed up as Joan Collins for the day. That was an absolute joy to see her. And it's about making the effort for this time. This was a big event for a lot of people. It was a big event for us. And I think that we made the absolute most of it about what we can achieve in the period of time. So we managed to vaccinate 497 people on the Saturday, and we got that to 607 on the Sunday. So you can see kind of our numbers and how we were able to do that. So okay, so let me just have a look. So somebody's asked what's happening next. So just let me answer one question that I can see here, and that's saying that clinically vulnerable and 75, when will they be contacted for housebound? Okay, the government has set that we must first vaccinate our patients who are aged over 80. So our clinical team are first going to vaccinate those people who are aged 80 in their own homes first. As soon as that's done, or nearing to completion, okay, about who can be done, we'll move into the next age cohort, which will be over 75 and the clinically extremely vulnerable, and then we'll move to the 70 and 74. I know that everybody wants to get vaccinated as soon as they can, and we are doing all we can to vaccinate you as quickly as we can. So what we've got though after this lot of vaccine, okay, is that we haven't been told when we're going to get any more. We do know that we do not have any delivery next week, so there is no vaccine clinic next weekend. That is because there are other parts of the country who have not vaccinated all of their over 80s as yet. So everybody that's aged over 80 or in a care home, they must be vaccinated. That is the government decision. They must be vaccinated first, and they are diverting vaccine to those areas where they have not met that target yet. So we will not be offering we will not receive any vaccinations next week to be able to vaccinate anybody else. Okay, now as soon as we get our next delivery that we're told of, we will come out to you and we will tell you, but we're expecting the government to update us accordingly. So I hope that's kind of clear. We've got this weekend and then we actually don't know when the next lot of vaccine is coming, but we know it's not next week. They're definitely not. There is no vaccine delivery week of the 25th of January. Okay. Is it possible to be vaccinated at the cathedral? Depends on how old you are, Tony. If you're over 80, you can go and ask them if they will vaccinate. Probably they'll say no, because either you need to come to Lark Hill and be vaccinated with us, or you'll need to receive AstraZeneca at home because you're housebound. This is all about which practices you're registered with and how that operates. Alice says, someone in social media suggested the second dose would not necessarily be the same as the first vaccine. Well, I wouldn't read everything that you hear, is what I would say to that. At the moment, we've been told the same vaccine has to be repeated at that 10-week point. That's what we've been told. So that's what we're expecting. Do you have a waiting list for critical workers? Now, it depends on what you call critical workers. However, information has been sent to every employer, we've been told, in Bath, Swindon and Wiltshire, advising them of what to do to ensure that their workforce are vaccinated. Okay, employers have an occupational health responsibility to get their staff vaccinated. Okay, and they've been sent information whereby they have to complete an Excel spreadsheet and they have to submit that to the CCG for all healthcare workers. So anybody working in health, okay, their employers have been contacted. Indeed, I've been contacted as an employer, okay, to be able to get the team vaccinated. Now, we have to submit those spreadsheets on a weekly basis and they are contacting people to be vaccinated. So my first question to you is, has your employer completed that Excel spreadsheet and sent that off? Because that's the most critical thing to do. If indeed you are a social worker, a care worker, indeed your employer has been contacted by Wiltshire Council to reply to Wiltshire Council and they are coordinating the vaccine for you. Now there is a huge enterprise vaccinating the workforce as well, and I have contacted the CCG to ensure that we are following the guidance that came out on Monday, and that is that the employers should be contacting those people accordingly. All right, so that's what should be happening alongside our patient provision. Okay, because they are a high priority, they're in priority 2 and must be vaccinated, and there is a huge scheme of work to get you vaccinated. I absolutely promise you that. I have been reassured of that on numerous occasions by numerous people within the CCG, and indeed I have the evidence of that because I have received those emails as well. Have there been any adverse reactions to the injections? Nobody had an adverse reaction as far as I'm aware whilst in our company, and we haven't been informed of that since. So at the moment, as far as we know, that's a 0. Yes, so very good information about the roads coming to us. The roads have been closed between Enford and Uphaven if you are coming that way on the A345. You will need to follow diversions if you're coming from Uphaven through to Lark Hill on tomorrow or indeed Saturday. We did ask the council, we did inform them that when the vaccines were happening, so that they perhaps could make adjustments, but they're not able to. So I'm very sorry about that. As I said, in terms of somebody's asked when AstraZeneca is in, I think you might have missed the beginning of the chat, and that was we are going out to book appointments for patients to be vaccinated in their own homes with AstraZeneca, starting actually vaccinating hopefully on Friday, because we have not been given the cool boxes yet to be able to transport that vaccine. So I'm really sorry, that comes tomorrow, that cool box. So we can't start until Monday because we don't have all the kit. And it's really important that we transport AstraZeneca, the vaccine, in the most appropriate way, according to good governance, and we need a cool box. And therefore, we are looking to do that on Monday at the present time. Unless, of course, that cool box comes in nice and early. And if that's the case, then we might be able to do a few tomorrow, okay? Can you confirm that carers will be called in to group 6? Now, we will always go with the current guidelines. They are the at-risk group. So as far as we know, they are in that group at the moment, but please, until the information keeps changing, and therefore we have to go with the current guidelines. And remember, we are not getting any more vaccine at the moment because the government agenda was to get to people aged over 70 or clinically extremely vulnerable by the 15th of February, and that's what the agenda is to achieve. Will people in groups 2 to 4 who can't have the current vaccine have to wait? Now, like I just said, I hope I've answered that. The plan starts on Monday to actually start vaccinating you. Now, at the end of Saturday, by the time all the data gets updated onto our systems, will we know who has not had the Pfizer vaccine and therefore may need AstraZeneca, and we'll be looking at holding clinics. But we need to get as many people in place and ready to do that because we can't waste any vaccine. We mustn't do that, and we need to coordinate this vaccine programme. Do you know if all local surgeries are arranging home visits in the same way? I don't know whether they're doing it in the same way because I don't know their procedures. However, I would expect everybody to have read and follow the national standard operating procedures for delivering AstraZeneca in various different settings, and that includes the home setting. So I would expect us all to be able to do that. Can you confirm no wastage of vaccine if people don't show up? Absolutely. Like I've just said, we used 1,045 out of possible 1,070 last weekend. All right. We will not waste that vaccine. That is what we do. We will absolutely use it all. And I've been able to account for the remaining 25 that we did not use. As I said, we did drop 2 vials. That happened. It was purely accidental. And out of 13 vials, did we only get 5 doses from, not 6. So we can account for every single drop of vaccine. And let me go on down the list. We've got in terms of allergies, I'm not aware penicillin is on the allergy list, and I know people who have had it, so I assume that it is safe for you to do that. However, remember, when you have your vaccine, you are being assessed by a healthcare professional to ensure that it's appropriate for you to be vaccinated. To be able to do that, can you tell me when over 65s with type 2 diabetes will be vaccinated, please? As I've said, I'm really sorry I can't tell you that because I haven't been told when our next lot of vaccine will be delivered to us to know what we can do and who we can vaccinate. I will tell you when we know, I absolutely promise you. Okay, somebody said that they would have preferred to have waited outside rather than inside. Indeed, if you want to do that, you can, but indeed, because we've got steps along the way for you to be registered, okay, that is an IT issue. You need to be inside for that. That actually it does take that amount of time, but we try and move things through as quickly as we can. Indeed, sometimes there were a couple of clinical issues that we have to address that holds things up slightly, and indeed, patients have varying need that do then cause a slight issue, but I know sometimes there was a greater wait outside in other places, and I think we didn't have anywhere near the wait of what you know could have happened, and so yeah, fingers crossed that happens again. My invitation for last Sunday arrived on the next day, Monday. I have not had an invitation for tomorrow, Saturday. Could I come? Please, can you contact your surgery, giving your details, and we will look to see what we can do to accommodate you. I assume, Mary, you're over 80, and that's why you missed your appointment. So please contact your surgery. Yeah, so somebody's saying they're moving. I was just reading then, they are moving to Provence in March. Yes, you can come back. I don't know when you are moving, but you know, yes, keep in touch with us so that you can come back and have your vaccine with us. Can you show us the number in each group? Now, I did that last week. I've had to delete that because I've just had so many things to do. In terms of that, I will show you again the other numbers. And indeed, if you review last week's, they haven't changed. So what I would suggest you do, review last week's data and the sheets that we showed. It's live on our website for you to watch. Go and look at that data again. You can see all of that, okay? So the same data for all the groups is up there. Go and have a look at that, but you've only got the data for the groups 1 to 4 at present, all right? Let's keep on looking down. Somebody else has said, what a brilliant job we're doing. Thank you so much. And I tell you what, it was lovely to meet so many of you, and the feedback that you gave me about the true value of these sessions, of meeting together on a regular basis and finding out what's going on, was so valuable to you. And that's great feedback, because I can see your messages, I can see that, but I can't get a sense of a feeling. And I'm just really appreciative, and I think that they've been a huge success for us all, about keeping together and working through this process to restore what we can achieve in 2021. In terms of this, a partner works as a carer, Alzheimer's support, visiting clients in their own home. Absolutely, they're a care worker, so get hold of the council. Your employer should be doing that for Alzheimer's support as a carer who's been paid to go around and see people to be able to do that. If employers are saying looking into it, that seems a bit odd to me. I can't comment, but I do know that employers should be putting your name forward to the council if you're a care worker to be vaccinated. Employers have an occupational health responsibility to get you vaccinated. I can't stress that enough. So looking into it, I know we're all busy. If they have generally said that, like you've referred to, then that's of concern. But I have to be honest, as an employer, my workforce are invaluable because they need to be out in our most vulnerable populations helping people. So I would really hope that those employers are just working through that process and are waiting for confirmation. But yeah, that it's really important. Let's just have a look. So we're coming up to the last kind of 3 minutes. Yeah, so for people who are having the AstraZeneca vaccine due to allergies, so not housebound, will they be following the same current procedure? SOPs are in place for vaccinating people with AZ, AstraZeneca, in a clinic setting. We just have to get enough people through, which we hope to do, like I've been saying, as quickly as we can. We just need all the numbers from this weekend to get everybody together, and then we can vaccinate. So yeah. Please keep up these videos. I think they're much more helpful than any other source. Yeah, we'll keep going, all right? What we know, we'll keep sharing with you. I'm being really honest about when we're getting our next vaccine, as in, I don't know. All I know is it's not coming next week. So I will keep in touch with you, I promise, about what we're doing and our numbers accordingly. So I think next week we probably won't have a live Q&A. The reason being is I will not have anything to tell you unless we are going to be vaccinating the following week. So no news, okay, please understand that means that we are not getting another delivery the next week. But if you get an invite for Q&A, that means we do have more vaccine coming, or we've been told when our next vaccine delivery is, even if that's in 3 to 4 weeks time. So please, if we don't go out to you for Q&A, it means that we're not currently vaccinating. We're waiting for our other cohorts, our other practices, our other clinic settings to catch up with their over 80s, their priority group 2s, to be able to work through, and 3s and 4s, etc. Okay, so we all have to distribute that vaccine. We have to work as a community, as a system across the nation to get everybody vaccinated. So yeah. Okay, let's have another little look. Can you confirm if the doctors and nurses we see in surgery have now been vaccinated? Yes, they have, because they have been vaccinating people this weekend. Some of them came in for set sessions, others came in to learn how to vaccinate, so that we have a huge cohort of people who can vaccinate you. I don't know. So somebody said, will I be notified for vaccination when it's my turn by SMS? We look at the number of people who have got SMS consent as to whether or not we go with letter or text message. In our cohorts who have been over 80 so far, we have had a dominance of people who have not had SMS consent, and therefore we have used letter. Okay, we tailor how we contact you according to how we best think we can get to you. So that's what we've been trying to do. Okay, so I've answered all your questions. We've had 61 this morning. I'm losing the plot. In terms of that, this evening, I hope that it's been valuable yet again. Okay, please, for any numbers from last week, look at last week's live meetings. We've done today, and thank you again, everybody who attended last weekend. It was a joy to see you. We're looking forward to those who are coming tomorrow and Saturday. And yeah, and rock on for the next sessions after that. So take care, keep safe, keep well, and we'll see you soon. Bye.